I'm Dr. Theresa Gallagher. I'm a licensed psychologist and the director of clinical training at Modern Intimacy. I went to undergrad at Ohio University and obtained a degree in psychology and women's studies there, and I went on to get my doctorate at Midwestern University in Phoenix, Arizona. I am currently also completing my certification in sex therapy at Modern Sex Therapy Institutes. I entered the mental health field because I felt strongly about being a person that gives back. I was raised by parents who told me you should always do the right thing and do what's right by people. Entering mental health felt like I was able to exercise that value. I spent a lot of time in women's studies classes and thinking about how I was going to mesh mental health and my desire to be in women's studies in some way. And that led me to sex therapy. It feels like I'm able to exercise both of those values to their fullest. I would say my therapeutic style is very solution focused. I realize that couples and individuals that come to Modern Intimacy really have a motivation to change. I like to set long-term and short-term goals with all of my clients, and one thing that I think is really important when individuals come to therapy is that we are able to be flexible but keep those goals in mind. Great work can be done in the therapy space, but it's important for individuals who come to therapy to think about the themes and discussions that we're having in therapy outside of therapy. So I oftentimes work with my clients to think about what can they do outside of therapy that's helping them realize their goals. I help couples with different sexual needs and values through kind of getting creative and exploring. It's not uncommon for couples or individuals to come to therapy and think that it's necessary for them and their partner to have the exact same needs sexually or values, but it's not actually as common as you would think. In therapy, I really help couples negotiate what it looks like to kind of meet in the middle and what looks like a good boundary. In therapy, I help couples collaborate and get creative. I work to create a space that's free of fear and judgment. My philosophy on the relationship between sex and mental health is that they're incredibly intertwined. We as individuals are sexual beings, and if we see that there is a difficulty in that space in our lives, it can directly affect our mental health. For many people, their sexuality is one of their primary identities, and if they feel like they're not able to exercise that identity in the way that feels authentic to them, it can drastically affect their mental health. A particular area of focus for me is working with couples who have mismatched libido or difficulty communicating about sex. Oftentimes work to create a space where couples can kind of share freely about their experience, how they've gotten to the place that they've gotten to, and work to recreate a new sexual script. Kind of start from the base and work our way up. It feels really rewarding, and couples seem to benefit a lot from that work.